Consul Orthopedic is a synthetic bone graft particulate specially packaged with a dual sterile barrier for use in orthopedic procedures. Nutramax Laboratories launched Consul Orthopedic as an alternative to either having the surgeon harvest bone graft material from the patient or to using freeze-dried material. The major benefit to Consul Orthopedic is its ease of use. It can be mixed with blood or sterile saline, and then it forms a paste, which is then easily applied to the surgical site, and it stays where it's put.
It also decreases surgery time. If we're going to use or harvest a cancellous bone graft, we have to prep that area. We have to go in and harvest that cancellous autogenous graft. That increases our surgical time at least 10, 15, maybe 20 minutes, depending on the patient. And then there's an increase in morbidity associated with that. Those dogs are much more painful, or cats, after harvesting those grafts. And we have an increased risk of fracture at that site, as well as an increased risk of infection rates potentially by harvesting an autogenous cancellous graft. We use it in a variety of cases. Our open fractures, absolutely, primarily because of the antibacterial properties. We'll use it in delayed unions and non-union fractures, comminuted fractures, because it packs very nicely into those large fracture gaps if they're comminuted. We use it in osteotomies for TPOs. We use it for TPLOs, especially because of the antibacterial properties, knowing that TPLOs have a higher rate of osteomyelitis than other osteotomies. For arthrodesis, carpal arthrodesis, you really can't harvest quite enough cancellous bone graft to cover all those joint spaces, and so we will mix it with cancellous, or we'll go ahead and use it just on its own for pantarsal arthrodesis. And then spinal fusion cases, if there's wobblers that we have to fuse vertebrae, we'll use Consul in those cases. I think it really comes in handy for the small and the toy breeds, again, the little toy poodles, the Yorkies, cats especially. Those breeds just don't have an adequate amount of cancellous bone graft, and so we don't even attempt to harvest in those patients. We just use the Consul straight out. So the way we apply Consul in the OR is that it comes in the prepackaged containers. We'll then add just a little bit of saline, enough to make it into a nice little paste that forms a little gelatinous gel that we can use periosteo elevator or a freer elevator to then apply to the actual surgical site. We almost butter it on in between the fracture segments, or pack it up into those comminuted areas. If you look at, this would be a TPLO, and we have an osteotomy here. Even though we compress the osteotomy site with the TPLO plate, we still have gaps within the osteotomy, especially proximally. And so we'll take our freer, take the then gel or paste type Consul product, and move it down and pack it into the osteotomy site where there are some gaps after the compression. Consul has also been shown to have osteoconductive properties. In other words, it acts as a scaffold for bony ingrowth during fracture healing.
Consul Orthopedic is a bioactive ceramic. It contains elements that are found normally in bone, such as calcium, phosphorus, and silica. When the material is placed into the surgical site, it undergoes a surface reaction. It results in the formation of a calcium phosphate layer, which looks to the body like the hydroxyapatite found normally in bone, and therefore does not cause a foreign body tissue reaction. It eventually is colonized by osteoblasts and is eventually replaced by bone. Complete replacement of the Consul Orthopedic material by new bone takes approximately 9 to 12 months.
It's been shown, especially in the literature, to speed up the rate of healing of osteotomies as well as in fracture models. It's been shown to have hemostatic properties. It's been shown to have antibacterial properties, and it's believed to have those properties due to increase in pH. So in cases such as the TPLO, where we know they have an increased osteomyelitis rate to begin with, it definitely would be beneficial in those types of cases.
Another benefit to Consul Orthopedic is its 5-year shelf life. Because of this long shelf life, a practitioner can purchase it ahead of time and have it on hand for use in an emergency. Consul Orthopedic is appropriate for use in dogs and cats, as opposed to freeze-dried material, which is an alternative on the market, which is species-specific. Consul Orthopedic is packaged in a 7cc cup, which is ideal for most orthopedic procedures. In large volume defects, greater than 14 cc's, Consul Orthopedic can be mixed with autogenous bone graft material. It has a dual sterile barrier. It has a cup inside a pouch. This means that the technician can open the pouch and the veterinarian can handle the cup in preparation for the surgical procedure. Consul Orthopedic is an excellent option for surgeons, especially to reduce complications from orthopedic repairs such as malunions or non-unions. Consul Orthopedic is a great product. It's perfect for use by orthopedic specialists and by general practitioners. The only additional steps to the surgical procedure are to mix it and apply it to the surgical repair site.